Today we're talking about something that affects millions of older adults and their families, but too often goes unrecognized or untreated: hearing loss. So stay tuned and we'll get into it. Hi, Dr. Lakelyn here. Welcome to Caregiver Chats. I'm a gerontologist and caregiving advocate for Home Instead, an honor company. I'm so glad you're taking the time to join me. These conversations are a space for learning, reflection, and support. And I invite you to subscribe to Caregiver Chats on Apple, Spotify, or wherever you get your podcasts. And don't forget, I love hearing from you. You can connect with me on Instagram at Caregiver Chats Podcast. If you've ever found yourself repeating things more often, wondering if a loved one is simply not listening, or noticing they seem withdrawn from conversations or family gatherings, hearing loss may be playing a bigger role than you realize. Here's the good news. Today's hearing technology has advanced tremendously, and there are more effective solutions than ever before. Joining me today is Dr. Debbie Abel, one of the most respected leaders in audiology. Dr. Abel has spent decades caring for patients, educating audiologists across the country, and advocating for better hearing healthcare. Throughout her remarkable career, she has served in clinical practice, leadership roles within the American Academy of Audiology, and today serves as the manager of coding and contracting services at AuD. She also helps coordinate a unique certification program with hearing care providers for hearingloss.com, a national website that educates people curious about hearing and hearing loss treatment. Together, we'll cover what every family should know about hearing loss, from spotting the early warning signs to finding effective solutions that can strengthen communication and enhance quality of life. I can't wait to get started. Hi, Debbie. Welcome to Caregiver Chats. I'm so excited to have you here today.
Thank you. I'm as excited to be here, so thank you for the invitation.
Oh, the pleasure is all mine. I'm so excited to dive into this topic of hearing loss. We know it impacts so many Americans and their families and family caregivers. And so I'm excited to really dive in today with some practical tips and information that will hopefully be very useful to everyone that's listening. So I thought we could start maybe by talking about the signs of hearing loss. I think sometimes it happens so gradually that maybe we mistake it for maybe just natural aging, or maybe mistake it for other things. So what are some of the signs of early hearing loss that caregivers should be tuning into or aware of?
That's a great question and a wonderful starting point. Probably the most common things, that an audiologist hears when a patient comes in to explain why they're there for the visit is, I can't hear in background noise. I have trouble hearing in a restaurant. So anytime there's competing noise, especially as we age, we experience our hearing loss first in the higher frequencies. And that's where consonants live. And that's what carries the meaning of conversation. So the high frequencies are also where women and children's voices usually are. So people will also complain about, I can't hear my wife, I can't hear my spouse or my partner, I can't hear my grandchildren. Oftentimes caregivers notice the television is a little louder than where they like it to be. And also some other things, and it's sort of a tongue-in-cheek kind of thing. When you see somebody driving down the road with their turn signal on, they probably have a little bit of hearing loss because the turn signals are also a higher frequency, and the driver may not be able to hear that with the road noise and everything else. And I think another thing, especially for people who enjoy listening to birds, especially with all these wonderful apps that identify birds, they don't hear birds as well, if at all, because again, that's another high frequency sound. And I guess the other thing is that I would mention is for those who enjoy classical music, it probably sounds a little dead. The music doesn't sound so sharp because flutes and violins are high frequency sounds, and that's a pretty important part of an orchestra. Yeah. So I think they're appreciation for classical music maybe has changed because they don't appreciate it as much.
Those are really interesting. And a few of those I had never considered before, like the birds and the orchestra. I think that's really, really helpful, especially as caregivers are maybe hearing their loved one complain about a couple of those things. It might be a sign, oh, let's go check out your hearing. Let's make a trip to an audiologist. And I know that, some our hearing changes as we age. Can you kind of differentiate normal hearing loss as we get older versus something more severe that we need to go to an audiologist for? Or should we just make an audiologist part of our routine, that hearing check as we get older? I would imagine it's a little bit of both.
I think you're right, Lakelyn. I think it is both. You're absolutely right. Hearing loss is so gradual, just like vision loss is. And you don't really realize it sometimes until you're on the other side of it and it's treated.
Mm.
Similar to cataracts. A lot of times I had a patient many years ago who had the most beautiful white hair. And before her cataracts, she thought it was yellow. When she had
Oh,
her
wow.
cataracts removed, she realized it was as white as paper. I think hearing loss is like that too. You kind of motor along and you don't realize one day, that you don't hear the birds, or somebody in your family is complaining, your caregiver or another family member's complaining because you're not responding when they talk to you from another room. That's another
Mm.
common hearing loss complaint. So I think once testing is done, which is painless, easy, and I think once that's done, and if any kind of treatment, be it hearing aids, be it some kind of an amplifier for your telephone or your television, whatever your lifestyle dictates, it could be. Um, and by that, it could be anything from, like I said, something you just set on your television to hear that better so that everybody in the room can enjoy it at the same volume level. There's all kinds of assistive devices that can help
Mm.
people, even right now. But the best thing to do, just like with anything, is yes, we should absolutely get a baseline at some point. Probably 50 is a good age to start. We've been exposed in especially in the US to so many loud things, whether,
Mm.
probably I'm sure I'm older than you, but years of rock concerts take their toll. If you enjoyed, target practicing and didn't use ear protection, those kinds of things also take their toll, but it's a good idea to get a baseline as soon as you can so you know where you are right now today,
Mhm.
and also have it as something to compare with as the years go by, and you can keep having that done periodically whenever you and your professional, hopefully an audiologist, decide when that's a good time to do. And a lot of other things come into play too. It's not always aging. There can be other
Mm.
reasons for hearing loss that can be remedied right while you're sitting there in an office. For example, some people have and are prone to having earwax,
Oh,
and
yes.
it plugs up your ear, and maybe it doesn't feel uncomfortable, but it's impacting, excuse the pun, but it's impacting your ability to hear sound very well. Once that comes out, that could be a game changer for you. So,
Yeah.
definitely, and that's something an audiologist can do as part of their scope of practice, and would highly recommend. It's a first line um, part of the exam. Nobody will do a hearing test until they look in your ears and make sure, that the pathway from your outer ear to your middle ear is clear and able to be visualized.
That is such an important tip, to just get that baseline early so that you have something to compare it to. I think that is true in a lot of areas of healthcare and medicine. Having that baseline just can be so helpful as you go forward. But I would be curious, Debbie, to hear from your perspective. What are the risks of not addressing hearing loss? What are people
Oh,
at risk for? I'm sure it's a number of things.
I think that's really an excellent point because other than hearing loss, it's the most chronic. condition in the US. It's twice as prevalent as diabetes or cancer. So
Wow.
I think that shows, and that's according to the National Institute on Deafness and Communicative Disorders, known as NIDCD. They have determined that. And so consequently, 1 in about 7 people have hearing loss in the United States.
Mm.
What has come out in the last few years are some other studies, such as Lancet and Dr. Frank Lynn, who, while he was at Johns Hopkins, came out with some situations and great anecdotal information about adults with hearing loss and how it impacts, but for those who don't do anything about it, how there is a line to cognitive decline. That
Mm.
is huge.
Yeah.
And we know the statistics on for example, everybody's beloved pilot, Sully, came out this past week saying that he has Alzheimer's. I
Mm.
believe he wears hearing aids, and that's probably having your hearing tested and hopefully having the treatment of hearing aids if they are recommended is certainly enough to hopefully stave off dementia or cognitive decline, because one of the reasons, and all the research is showing, one of the reasons for cognitive decline is lack of social interaction and
Mm.
isolation. Hearing loss, untreated, can lead to isolation because
Mhm.
you don't want to go out and talk to your friends because it's embarrassing if you have to constantly ask for repeats or your
Yeah.
caregivers. It's embarrassing. So you start withdrawing. You don't go to a gathering. Maybe you go to once a month, and it's just easier to turn up the television, and you wind up being isolated, and you're not getting that social interaction that you need in order to keep your brain engaged and
Mm.
and things along that line. It can also lead to depression, and
Mm.
that is isolating in and of itself. And there are things that can just be done that are easy, whether it's going to a senior center in your community. They have speakers, they have activities that you can participate in. Your Chamber of Commerce can probably hook you up to those things if you're not sure how to do that. Your house of worship. There's all kinds of abilities to interact with people socially and otherwise in that kind of a background as well. So, reaching out to your caregivers, your loved ones, your family is a really good first step in getting that interaction to
Mm.
continue.
Those are great warning signs, or I guess they also are kind of warning signs and impacts of hearing loss. If you're starting to see your loved one withdraw from things that they once enjoyed, maybe there is some hearing loss happening. And the risk of not addressing is that isolation. And we know that isolation can impact health in so many ways. And,
Absolutely.
increasing the risk of cognitive decline, certainly one of them. And that was something I wanted to cover with you today, Debbie, is the connection between dementia and hearing loss, because sometimes it's talked about as like the chicken or the egg, which comes first. Those were some helpful insights. Anything else to add on that topic?
Yes, and I would say very clearly, and I'm very sensitive about this. While treating hearing loss can be a mitigating factor for cognitive decline, it's not a cure to stave
Right.
off
Yeah.
cognitive decline. At this point, to my knowledge, there is nothing to do that at this point. You just try and get diagnosed early. There are medications, of course, that can be utilized for that, and in just keeping social isolation at bay is
Yeah.
probably a good step. There's one other thing, if I could also bring up,
Yeah.
is falls risk.
Yes.
There is a line between falls risk and hearing loss as well. And that has been kind of brought out in some recent studies as well. And it makes sense because if you go back to your high school anatomy, you probably remember your balance system sort of sits on top of your hearing system. So they are kind of connected in their own way. So things to mitigate falls is certainly something you want to speak to your caregiver about. Maybe that cute little rug you have in your living room shouldn't be in your living room. Maybe it shouldn't be anywhere because it could be a falls risk. And as we get older, the risk of falls happens anyway. So my understanding from the Center of Disease Control that 1 out of 10 falls results in an injury. And
Yeah.
once you fall, you're at risk for other falls. And of course, that gets worse as we get older. So that's something else that audiologists can assess is the reason for falls risk, and some treatment can be done if it's on a vestibular basis, which is the section of your ears that are in charge of you maintaining your body awareness. So that's another thing I would like to highlight as far as
Yeah.
having an audiological evaluation done. It's not just about hearing; it's also about your brain and also falls risk.
Wow. Yeah, that is one tie that I don't think a lot of people know is the connection between hearing loss and falls. And I think there has been some kind of public polling, and dementia and falls are two of the most feared things as we get older.
Sure.
So if we can address our hearing loss, good news, it could help mitigate the risk of both of those. So I think that it's definitely a much broader conversation than just hearing loss. And I'm so glad, Debbie, that you shared that the audiologist can help kind of assess some of those other areas of concern as well. It's not only just about hearing. So I think that would be kind of a great segue into a question I was planning to ask about seeing an audiologist. Some people might think, oh, my hearing's getting worse. Well, maybe I'll just buy one of those over-the-counter hearing aids. I don't need to go to an audiologist. What is the value of seeking out an audiologist, professional in this space? And how can people go about that if they don't already have an audiologist?
Oh, that's really a great question. I think probably finding an audiologist, people talk, those who have seen one, and love their audiologist will tell all their friends about that adventure that they had, when they went to go see an audiologist for an appointment. So hopefully that if they have no idea where to start, they can certainly have that conversation with their primary care physician who would know who to refer to. You can, do anything from a Google search to looking it up on, some of the grading applications that there are for seeing medical professionals. Um, so that's another option. But, word of mouth, contacting that senior center I mentioned earlier, but probably, if they don't have any direct contact to an audiologist, probably just having the conversation with their primary care physician. They can come, if you want to get into the insurance discussion, which is sort of my wheelhouse, Medicare Part B will cover an audiologic evaluation if the patient has noticed a change in their hearing, their balance, and or tinnitus or sound that people have in their ears or in their heads. So that's always a good place to start as well. The Advantage plans, Part C plans also generally cover diagnostic hearing evaluations, and that's always a good place to start too. And that goes back
Yeah.
to our conversation about baselines.
Yeah, I think that is a really helpful thing to know is that these are generally these hearing evaluations are covered by insurance, because I know that's a concern too for a lot of folks as
It
well. So
is.
Yeah, so taking advantage of those evaluations that are provided by your health plan, and seeking out an audiologist. So, Debbie, when somebody goes in for that kind of baseline evaluation, what can people kind of expect? What are you mentioned checking for the earwax? I caught that earlier, and then what else will they kind of evaluate?
Sure. So generally, what most audiologists that I know of and did when I was seeing patients clinically is, they come in, they've set up their appointment, you greet them, they come in, and you just have a conversation about, tell me about your lifestyle, what's important to you, looking at goals. If you're having trouble hearing, where are those places where you are, and how is that impacting you? And your family and your caregiver as well. They'll go over past history in terms of medications, because there are some medications that can cause hearing loss. And there's
Interesting.
probably more medications that can cause falls or
Hmm.
dizziness. So, an audiologist will try and vet that for you to see what are you taking, and they can have a conversation with your primary care physician or the pharmacist or anyone else about the impact of that. Also, just going over not only occupation, what kind of work did you do? Were you I lived in a rural area where I had my own practice, somewhat rural. We had a lot of people that did farming. And
Mm.
and also it's so interesting, which year may be worse because they're looking over their shoulder to make sure the tractor's following them. So they
Ah,
wind up having more of a hearing loss in one ear than the other.
so
Truck
interesting.
drivers, same thing, because the window's right by your left ear. So you'll see some things like that depending on what somebody did occupationally, what they did for their life work. Also, that can impact things is what you do recreationally. Like I mentioned, rock concerts, even though it might be 50 years ago, it still has an impact as far as cumulative noise effects. Or you worked in a factory when you were in high school, to earn money for college, or you worked in a factory as your life work. Those things have their impact on your hearing, and it's cumulative. So even though you thought at 20, "Ugh, I'm invincible," you're not, it's not, our ears aren't invincible, and it
Yeah.
takes their toll over time. So those are some questions that'll also be asked. Again, what medications are you on? For example, somebody that's taking an anti-neoplastic for some kind of chemotherapy, some of
Mm.
those will impact your hearing immediately upon treatment.
Wow.
And that's helpful to know that. So you want to get a baseline before you start treatment, just so that can be monitored as well. And an audiologist can do that too. So once they get the case history, then the fun part begins. The audiologist will look in your ears to see, as we mentioned already, make sure that the path to your middle ear, where your eardrum and all your smallest bones in your body live, in your middle ear, and to make sure that that's intact and that testing can go forward. And then generally, and you probably remember this even from your grade school days, tell me when you hear the beeps.
Yep.
And and that sets up a graphic photo, in essence, called an audiogram, that looks at your right ear separately from your left, looks to see where your hearing acuity is from low frequencies to high frequencies. And you'll see a graphic depiction of that on the audiogram. So that looks at how loud things have to be in order for you to hear them.
Mm.
The other thing that's generally done at the initial visit is something called speech audiometry, where you have people repeat two-part words like hot dog and baseball. They're balanced for their syllables. And then the volume gets quieter. So that looks to see at the lowest level you can hear those. And then one part words like dad or dog are presented at an elevated level above that, to see how, when things are loud enough, are they going to be clear enough? So
Mm.
we're looking at two things. How loud does sound have to be? And how clear can things be at conversation levels?
How interesting.
Yeah. And then that's the recommendations are given from that. Maybe other tests are done at the same time. There's a test that looks at middle ear function that can plot out some maybe 6 different pathologies. So if somebody had a perforated eardrum, for example, you'll get a certain reading or non-reading from that. If they have fluid behind their eardrum, such as with a cold, or maybe you just took a flight and your ears can't clear or pop, maybe you've got fluid
Mm.
behind your eardrum or your eustachian tube is blocked. It'll plot out typical patterns, and you can see that graphically as well. And that's generally done if somebody's complaining about, muffled sound, or their ears don't feel comfortable, or things like that. And then there's some other tests that can be done as well, just depending on the findings
Yeah.
of the hearing evaluation. And then recommendations are made, and we go from there.
Well, I think, and that's one of the most helpful parts is talking through the results with the audiologist and planning for those recommendations. Because there are so many tools out there now. I feel like hearing aids have come such a long way.
They have.
They're more discreet than they ever have been before. There are more options. And so being able to discuss those, make sure that you're getting the tools that are going to be right for you. Because as you mentioned, some people might have issues with the frequency or the pronunciation or the clarity of the sound. So I would imagine that the recommendations really are paired with the findings, which I know would be so helpful.
They are, as well as the patient's lifestyle too. That makes a difference. You mentioned earlier about over the counters, and I didn't really address that at the time, but if I could now,
Yeah, please. Yeah, I
yeah.
would love to
So
talk about hearing aids in general. So we can maybe segue into that topic because, as I mentioned, there's been so much change and evolution in the hearing aid space. So maybe let's talk about hearing aids and over the counter versus getting them through maybe an audiologist or something of that sort. How do people get hearing aids? What are the options?
and there are a lot of options, and over the counters became available for two reasons. Because up until over the counters were created, shall we say, several years ago due to legislation, um, they became available, and it was to increase accessibility and affordability.
Mm.
But I'm not sure it's met the muster of both of those, because if you go online, you will see a lot of different price points, and you have to choose what's best for your pocketbook as well as your lifestyle. So an over the counter is designed for what's called self-perceived mild to moderate hearing loss. There's a school of thought that says, well, how do I know I have that kind of hearing loss unless I get it professionally tested? And that's the answer would probably be you might not. And what's mild to me may not be mild to you, Lakeland, depending on your
Mm.
lifestyle. So, someone who is happy to stay at home and not go out, maybe doesn't have very many friends or family, they're content to stay at home, and maybe an over the counter is perfectly fine for them. It's kind of, pay and play. You just put it on, and some you can adjust and some you can't. Um, but if you go along the lines of a prescription and hearing aid, and the idea also of OTCs, because of the affordability and accessibility, is that you don't need to see a professional. You
Mm.
can do it yourself. Sort of like cheaters.
Yeah.
I'm going to go to the store and just pull a pair of cheaters at a certain specifications that I need, and I'm set. With hearing aids, if you do prescription hearing aids, you do need to see a professional, because those are, and they're all, kind of come under the tutelage of the Federal Drug Administration. So prescription hearing aids are probably a little bit more personalized for someone, because the amazing part that you alluded to is with these changes in technology that are fabulous. And finally, technology's kind of caught up with what people need.
Mm.
The ability to change a hearing aid when you go in to see an audiologist. So say they say, yes, you will benefit from amplification. We're going to go ahead and get that process started. And that process is including as to what your hearing loss needs in order for you to function in the places where you want to function better in terms of your hearing. So you actually hook up the hearing aid to a computer, and
Oh,
it puts,
wow.
yeah. So before, it's sort of like one size fits all, and OTCs are sort of like that, but prescription devices are more streamlined and personally adjusted for the patient. So the audiogram is generally included in the programming part, so that if your hearing is normal in the low frequencies, you don't want amplification there. You don't need it,
Right.
but you want it in the high frequency. So the audiologist can go into the software of the hearing aid and adjust, sort of like a graphic equalizer you might have on your stereo, and
Yeah.
just give you the boost you need at those particular frequencies where you're not hearing with your own ears.
That's incredible. I didn't know that about
Oh,
those
good.
personalized hearing
I'm
aids. I
glad.
learned something new.
Good. And they may start you off, especially for a new user, because, you're going to hear things you haven't heard for a long time. Often people would say they'd step out of the office with hearing aids on that first time, and they'll say to their caregiver, "Oh my God, I can hear the birds." They didn't
Wow.
realize the birds have always been there. They just haven't been able to hear them.
Yeah.
So that's always a treat. Um, I can think of a couple other things that patients used to always be a little bit surprised about. How loud their partner chews. Some things that they just weren't aware of because they couldn't hear them so well. So it really, the graphic equalizer part that can be adjusted on the hearing aids really brings in sound as the patient needs it. And for a new
Mm.
user, it's an adoption and adaptation process. So
Yeah, I wanted to know
maybe,
more about that.
yeah, so maybe they'll start you off maybe up here is going to be premium for what your goals are. But we don't wanna necessarily start you up there because you haven't heard sounds for so long. We don't wanna bowl you over. So maybe
Mm.
they'll start like at a level 1 and then work you up. So eventually you will be there, but maybe not at the very beginning, because you want it to be a pleasant experience, and you need to
Yeah.
get used to sound, and that's where your brain kinda comes in too, because of the plasticity that our brains have in getting used to sound, knowing where sound is. That's kind of, I used to
Mm.
joke with my patients, we have 2 ears, so we can localize sound better. We can understand conversation better when there's background noise, not just for, hanging earrings and glasses on.
Mhm.
So, 2 ears really, is so much better as well, if that's indicated. There's times where people may not have hearing in one ear, or even don't have, an auricle, or, the pinna or your outer ear. So adaptations can be made for that as well. But it's a process, and it's a relationship that you build with your provider so that they know and can get you to what your goals are, and meet those goals.
I think that that's really helpful to understand that when you put on those hearing aids for the first time, it is going to take a little bit of adjustment.
Mhm.
And your brain has to kind of figure out how to hear again, how to process that information. And so I think that's really helpful to understand that sometimes they will work you up to that full strength sound. And that it's not like glasses that you put them on and you see clearly right away. It does take that little bit of adjustment.
It does, and some people adjust to it very well, and some people just take a little bit longer. but there is a trial period or an adjustment period. So you want to ask your audiologist what that is. That may be determined by the state licensure laws in your particular state, so that you can return the device for either another one, or if maybe you're not ready yet. And maybe you just think, I don't want to deal with this right now, or you have other issues going on, as we do sometimes. So those are things that can be discussed with the provider. I can tell you, having lived in the state of California, they are the only state where you can return hearing aids and get all your money back.
Wow.
Some practices may retain a little bit because of the time it takes to do this. A fitting generally takes an hour. And then it doesn't end there. They're going to have you come back for rechecks to make sure, how are you doing? What's bothering you? What do you love about these? So those things can all be addressed when patients come back for rechecks. So that's always a question to ask. And they will also do a test. So there's 2 tests that I'm going to promote for a minute. There's a test that may be done before you even get to the office to pick up your hearing aids. It's called an electroacoustic analysis. Your hearing aid is put in a test box to make sure it's working up to manufacturer specifications, because things get moved around and jostled in shipping, and we want to make sure everything's working. Another thing that's wonderful about newer hearing aids are directional microphones. So you have a microphone picking up things in front of you. You have one picking up things behind you. If there's somebody noisy in a restaurant behind you, you don't necessarily want to hear them. So the hearing aid, if it's set automatically, can shut those back mics off so you don't pick up that unwanted noise, and you can focus on the person in front of you. There are also applications you can adjust on your watch, on your phone, to adjust the volume.
I was going to ask about that. My father-in-law can adjust his on his phone, and
Isn't
he can
that
take
great?
Calls. He can take calls too through his hearing aids, which I think is really neat.
Yeah. And I was going to touch on that. So Bluetooth has been an eye opener for a lot of folks. So that's an adjustment. You pair your phone to your hearing aids. So when the phone rings, it goes right to your hearing aid, and you can hear so much better on that. You can also pair Bluetooth with other devices, televisions, computers, whatever else has the capacity for Bluetooth. And now there's something new coming around that's going to have even more ability for people to access their environment. And it's something called Auracast. So and it's just coming to the States. So not everywhere has that yet. But say you decide you want to go to the local playhouse. If they have Auracast, it'll go right into your hearing aids, and you'll think you're probably on stage with the players, because the sound should be that good. So
what a game changer for so many people.
It is. And so thank you for telling me about your father-in-law, and I'm thrilled that he's using his hearing aids in such a great way. But the other thing is, the older hearing aids had one program, and now the newer ones, because they're digital, have the ability to have separate memories. So maybe you have the audiologist set one for when you're at home or listening to one-on-one conversations. Then you can have one for when you go to restaurants, and it knocks down some of that background noise. So that part of the technology that you just mentioned is really so much better than, the days of old, as we could call them, when hearing aids were only analog.
Well, and talk about reducing isolation, to be able to have a setting where you can go out to a restaurant and feel comfortable, or be at a family gathering and reduce that kind of background noise. Go to the playhouse and enjoy a play, or to the symphony and hear the orchestra, the flutes, and the higher frequency instruments. That is a beautiful thing. And one last thing I wanted to touch on with hearing aids, because as we were prepping, you shared that just like a lot of things, like your car needs a tune-up, it needs an oil change, your hearing aids also maybe need a tune up or to be cleaned if you're a lady who likes a lot of hairspray, or maybe you're one that has a lot of the earwax and it gets on it. So can you talk just finally about the kind of tune up process of the hearing aid?
Sure. So the audiologist may set up a time for you to come back for periodic cleans and checks where they will clean the microphone where the sound goes into your hearing aid. They may show you how to do that, or maybe they'll have you come in and have that done as well. So that's where sound goes into, and then it comes out generally somewhere in your ear. And sometimes people with hearing aids notice they build wax up quicker than they did before. They can show you how to clean that. With some of the really tiny behind the ears, there's a dome that goes on the end of the part that goes inside your ear. They can show you how to replace that. They can show you how to clean the receiver or the speaker part of that. There's a little trap that they can put in, and they can show you how to do that yourself. If that's not something that the patient can muster and handle, then the caregiver is certainly a part of that, showing them what I used to call the care and feeding of a hearing aid. Most
Mhm.
of them are rechargeable now. You just put them in a docking station. You don't have to mess with batteries unless you want to. That's a matter of convenience and other issues. So, yes, the audiologist generally will have the patient come back periodically, as well as making sure once you get hearing aids, there's no guarantee they're meeting what your needs are. So they might
Mhm.
assess that annually. Maybe it's doing a test to make sure that your hearing hasn't changed. And if it has, then can the hearing aids be adjusted and retuned, just like they did initially, in order to get you the best benefit out of them? Because, it's an investment. There's no doubt
Mhm.
about it. And with any investment, whether it's your car, like you said, you take it in for oil changes and tire rotations. You want to do that with your hearing aids as well to make sure they are functioning as they should be for you based on what your current needs are.
Debbie, thank you so much for giving us kind of the hearing aid 101 lesson, because I think it's so helpful because like I mentioned earlier, there has been for so long such a stigma kind of around hearing aids, and people don't want to wear them because they don't want people to know that they have hearing loss. But so much has changed and will continue to change and evolve as hearing aid technology advances. But I know that so often, because there can be that stigma, families sometimes are hesitant to bring up the topic with their loved one, or they maybe are noticing changes, but they don't want to offend their loved one. So, do you have, as we kind of wind down our conversation today, some kind of practical tips for families on how to have the discussion or how to bring up this very sensitive topic?
That's a great question. And, so much of that is driven by the person's personality, and
Yeah.
hopefully their caregiver knows how to best approach them about sticky topics or what could be sticky topics. But I think it's just important to say, if it were my partner, I would just say, I've noticed you seem to be struggling in this situation or that situation. Why don't we both go get our hearing tested?
Mm.
And we'll do this together. That's usually a good way to do it and see. And I also wanted to highlight that we talked about in our prep call as well as, not everybody, and Medicare Part B is designed for those 65 and older, and not everybody 65 and older needs hearing aids. There are
Right.
other things that can certainly be the issue, and other things that can certainly be done. So I would look at that as well. And that's part of the evaluation process when you see an audiologist. That's important. But I think just knowing how to approach them about certain things, and not, I don't know how else to say this, not be a nag about it, because people
Mm.
don't like to be nagged.
Yeah.
But I think if you just say, I've noticed, or you seem to be struggling in this kind of situation, and just make them aware of it, and let's do something about it so you don't have to struggle. People
Yeah.
with hearing loss that don't often do things about it often experience fatigue because they're struggling
Mm.
to hear. And they may not realize that. And I've had a lot of patients tell me once they got hearing aids, because they weren't struggling to listen, they didn't feel so tired anymore. So I think that's another nice little byproduct about doing something about your hearing.
Yeah, I never considered that fatigue could be related to hearing loss because you're
Mhm.
right. If you're having trouble hearing, your brain is having to work extra hard to try to hear the
Exactly.
conversation and process the information. So I think maybe too, just adding to some of your ideas is maybe talking about some of the benefits. Or if you have a friend who got hearing aids recently and has had a really positive experience, sharing that. Or just at the very least saying, like, I love your suggestion of let's go together and get our hearing checked because that baseline can be so important. And it seems like just based on our conversation today that there are so many benefits to addressing hearing loss that, it is
Absolutely.
certainly worthwhile to do for all of us as we age, to get that baseline and continue to monitor. And it might be that it's not your partner that's noticing the hearing loss because maybe, again, it's so gradual that you're just kind of getting used to having to talk louder or repeat things. But it may be somebody else in the family, like an adult child or somebody who's come for the holidays and is like, oh, wow, I think dad's hearing is a lot worse than last year at this time.
Exactly.
So I would encourage, all the family members of that individual to just get a little curious. Ask those great questions. Hey, I've noticed, at the gathering, you really didn't engage in conversation.
Mhm.
Have you been having any trouble with your hearing? I know in our family, my grandma, she has hearing aids and, in the big family gatherings at the table, when it's really loud, we have a lot of family, a lot of young kids. Sometimes she's not as talkative, but in more of the one-on-one setting, she, is definitely more chatty. But I make a point to, make eye contact with her, speak directly to her, and include her in the conversation. And so I think, just taking a little extra time to, notice these changes, address them, and include them still in the conversation. Don't let them isolate or don't let them withdraw from those social situations. So it's really important for families to make sure if their loved one's starting to withdraw, not to just, assume that's normal aging, but to lean in, get curious, say, okay, could hearing loss maybe be why my loved one's withdrawing?
No, and that's really a great point. Whenever there's a family gathering, there's always a lot of noise. People are excited to see each other, and children are screaming and having fun, and maybe they're watching a football game because it's Super Bowl or holiday time in anything. So the television can be somewhat distracting, so and loud and invasive. So that if they can eliminate some of that background noise. And the other thing is call that person's name to get their
Mm,
attention. Seems so basic, but at least it gets their attention and maybe helps eliminate what people find so irritating, and that is repeating things,
yeah.
and eliminate any background confusion so that you're having more of a one-on-one conversation, but also kind of scan the room, see, somebody who's usually not quiet all of a sudden is, you'd want to ask what's going on. I noticed you're kind of retreating here. Why is that? So be curious is a really good motto. And I like that, Lakeland.
Yeah.
So thank you.
Absolutely. And I love those additional tips that you shared. Call their name, get their attention, speak directly to them. I also know I sometimes am a person who covers my mouth, like I lean on my hand. So making sure that they can see you when you're talking, that can also be really helpful.
Yes.
So just those little things, you're right. They're so simple, but they can make a world of difference in how you communicate with your loved one who maybe is experiencing a little hearing loss or trouble hearing. So such great
Exactly.
tips. And Debbie, as we wrap up today, this has been such an informative conversation. I would love to know, are there any resources, that would be helpful. I know there's a great website, hearingloss.com, that you're connected with. So tell us a little bit about that and any other resources that you direct families to.
Sure, there are a lot of resources out there. Another way to find an audiologist is to go to one of the national audiology organizations, be it the Academy of Doctors of Audiology, the American Academy of Audiology, the American Speech, Language, and Hearing Association. They have on all their websites, find an audiologist. And you just put in your zip code and some names will pop up. So I think that's a great resource. They also have consumer-based resources as well. The Hearing Loss Association of America, which is the largest group that is, their thrust is to help people with hearing loss. They have enormous resources. And again, that's Hearing Loss Association of America. I would look at that. I would look at two of the ones we named today, NIDCD, as well as the Center for Disease Control. They have a lot of information. Look at the websites of the providers in your area. They also have a lot of information. And then asking about hearingloss.com. So Lakelyn, thank you for that. There, one of my colleagues, Dr. Cliff Olson, has done a huge amount of videos to educate consumers. So you could Google him, Google hearingloss.com. He created hearingloss.com. We have members who are hearingloss.com certified. There's also Hearing Up, which is another one of his networks. So Cliff Olson, Olson, is an audiologist, practicing audiologist in Arizona. He's created these amazing videos that if all it takes is the time to sit and listen, and he'll walk you through his thoughts on everything from real ear, which is how you make sure so I talked about electroacoustic evaluation, making sure the hearing aid is working before you get it. But there's also a test that you don't have to do anything. And it looks and makes sure that you are receiving the amplification that you need at the frequencies you need it. And all you do is sit there and listen to a passage. It's terrific. So Cliff has a dedicated video on that. It's called Real Ear Measures. And certainly you can look at his website, and then it'll direct you to a provider as well. So Lakelyn, thank you for bringing that up.
Well, thank you for sharing all those fantastic resources. We'll make sure to include all of them in the show notes in case you're listening and didn't have a pen and paper handy. So we'll capture all of that so that folks can check out the show notes for more on all of those important resources. And Debbie, gosh, we have covered so much today as it relates to hearing loss. And I just want to thank you for your time and expertise. I hope that this episode has been so helpful to families. I know I am taking away a lot of great tips and information. So thank you for joining me.
Oh, thank you for saying that. And thank you for asking me. You can tell this is a passion of mine. We just want people to be able to function well and enjoy life. It's a quality of life issue. And we want to have people be the best they can be. So thank you for having me.
Dr. Abel, thank you so much for sharing your expertise and helping us better understand how hearing health affects so many aspects of healthy aging. One message that really stands out from today's conversation is that hearing loss isn't simply about volume. It's about staying connected to the people and moments that matter most. Whether it's recognizing the early signs, encouraging a loved one to seek care, or simply making communication easier at home, small steps can have a meaningful impact on the quality of life. If you enjoyed today's episode, please subscribe, leave a review, and share this episode with another caregiver who may benefit from hearing it. Be sure to connect with me on Instagram at Caregiver Chats Podcast for episode updates, caregiving tips, and more. Thanks for listening, and please remember to take good care of yourself while you care for others. Caregiver Chats is brought to you by Home Instead. If you're looking for in-home care to support you on your caregiving journey, please visit homeinstead.com to learn more.